it's almost triple the amount of increase in, I believe this is nasal volume. I'm not. Could you explain this? Do you understand what is being shown in this graph?
Mhm. So this is basically depending on the type of expansion from the front to the back. This is just a diagram. This has not been done on real patients
Hmm.
to really confirm this diagram. Based on it's not clinically based. It's a great diagram. It basically shows the change in the volume of the inside the nose with different type of expansion.
Hmm. And
And I think
so,
geometrically, I think it's beautiful. It makes sense, but we are talking about clinical parameters of sleep and breathing, and we cannot really apply this diagram directly to the patients. I get patients that had ease, and I don't see much expansion in the nasal cavity after the ease. And I had patients that had non-surgical expansion, that had a beautiful parallel opening all the way from the front to the back. I had a lot of surgical assisted cases where they had traditional surgically assisted expansion where they didn't even open in the back. And I
mhm,
had patients that had the piezo done from the front to the back. There is a cut in the back of the maxilla at the level of the PNS, posterior portion of the palatal processes, and there is no expansion. Sometimes when you make a cut, you see that you think that, oh, that's widening of the suture, but it's just a surgical cut in the bone, and there is no widening at the level of the concha, posterior nasal concha, at the level of the uh, um, retronasal pharyngeal space. So I think this diagram is great. Geometrically, it totally makes sense, but there is no evidence to suggest that ease is the only procedure that offers the parallel expansion from the front to the back. And I had patients,
okay, so
yes.
you're saying a few different things. You're
Mhm.
saying that uh, this triple increase in volume that this diagram is trying to suggest that ease gives as compared to a MARPI, you're
Mhm.
saying this does not pan out in terms of patient experience of airway improvement. That's one thing you're saying.
Yes.
You're not getting uh, patients reporting triple the improvement with an ease as compared to with a custom MARPI.
That's correct. But I also want to say that the claim that you can only achieve anterior posterior parallel expansion with ease is untrue, because you can achieve parallel expansion from the front to the back with other non surgical type of expansion protocols.